Hi, I'm Frank Diamond, the managing editor of Infection Control Today. We're helping infection preventionists, environmental services teams, and other healthcare professionals on the front lines battle COVID-19. With me today is Charles Gerba, who is a professor of environmental microbiology at the University of Arizona. Professor Gerber has written hundreds of articles and books, and it's very possible that you've seen him on television. That's because Professor Gerber is an internationally known expert on the methodologies used to detect pathogens in water and food in healthcare settings and even in the home. Thanks for being with Infection Control today, Professor Gerba.
Thank you. Good morning.
Now, I just mentioned environmental services staff at hospitals. They're kind of the unsung heroes during this COVID-19 pandemic. Are they not? I mean, they're the people who go in and clean the hospital rooms or the operating rooms or even the emergency departments. Uh, they've kind of been, in a way, overlooked. Is that a fair assessment?
Yes, it is. I mean, they really, at least, would likely have the greatest exposure. And I think it's more important because you're usually dealing with an environment where people are coming in because they are ill. So they're usually secreting or excreting the viruses that they're ill with or other pathogens.
Have you have the heads of those environmental services reached out to you and asked for advice on how to handle this?
Yeah, we're working with the university. There's a lot of concern, of course, with educational institutions when all the students will be coming back in the fall. How do we guarantee we've taken every precaution to reduce the spread of the SARS-CoV-2 virus in the institution?
And what are you telling them?
Well, I think basically what you need to do is really enhance the availability of certainly hand sanitizers, come up with a disinfectant plan to work on surfaces, and hopefully we can come up and use more innovative infection prevention things like using continuously acting disinfectants on surfaces, because I think they play a new barrier in the role for spread of viruses and bacteria by fomites, inanimate surfaces.
So you're talking to something other than what's generally used up until this point, which was what, bleach, you, I don't know.
Yeah, I think some people have referred to these as continuously acting disinfectant surfaces. And that, in other words, when an organism comes in contact, it starts becoming inactivated right away. I think copper surfaces have been used somewhere in the healthcare industry, and they're really like continuously acting disinfectants, if you would have it. But we're looking at it in a more broader sense. We've looked at it as really one of the new barriers in infection control. I look at it in the last 20 years, the innovations have been hand sanitizers, disinfecting wipes, which give the right amount of disinfectant to a surface. And I think the next innovation is going to be the continuously acting disinfecting surfaces. Because what the problem is when the application of disinfectants, they will inactivate or kill what's on there, but these surfaces can become contaminated right away again. And that's why I think that's the role of the continuously acting disinfecting surfaces, because we know these surfaces are going to be continually contaminated all the time. I think they might play another important role too, in that we've emphasized largely the high touch areas as playing the major role in disease of infectious organisms and the spread in indoor environments. But the low touch areas are also important. I think we ignore them a lot. And I think we need to give more credence to them. And the advantage of these continuously acting disinfectants, they can cover all surfaces. So you'd be able to cover what I consider probably a neglected area in infection control, which is really the low touch areas too. Studies that have been done show they can be important too in the spread of infectious microorganisms in healthcare environments.
When I say environmental services staff, what do you mean by that? What's the common meaning of that?
Yeah, we're talking environmental, excuse me, in surface, people that are involved really in the environmental health service staff, so the people that are involved in the day-to-day cleaning of rooms, not only patient rooms, but facility rooms and that.
the maintenance crew, right?
Yeah, really your maintenance crew. I mean, they play a much more important role than most people realize, I think. In studies we've done, certainly in healthcare environments and office buildings and that, we know viruses can spread very rapidly on surfaces. And these custodial crews, basically, or people who are involved in maintaining hygiene situations in patients' rooms, play a very important role of controlling exposure to infectious microorganisms all the time. It's neglected. We always think of it as cleaning, which is really removal of dirt, but they play a big role in hygiene. I think they should really be renamed to both cleaning and hygiene preventionists too, because they play a major role in reducing our exposure to infectious microorganisms via fomites, inanimate objects that we touch all the time.
In the best of all possible worlds, are they in constant contact with infection preventionists who make up a portion
Yeah,
of
these crews themselves are coming in contact with infectious microorganisms all the time. That's why, using gloves and proper attire, I think is really important too. You have to recognize they do expose themselves too. And that's why it's important that they be specifically trained to realize that they actually are coming in contact with these organisms. In the healthcare environment, the emphasis has largely been on hospital acquired infections, which is really concerned about exposure and transmission among patients. But I think we also have to be concerned with the exposure of the people who do the cleaning and that they're properly trained and have the proper tools to clean and disinfect areas that could be involved in transmission of infectious microorganisms.
infection preventionists. They make up a big part of my my readership. How closely, in your experience, how closely do they work with environmental services staff, uh, train them, give them tips about how to go about their cleaning duties, their disinfecting duties, monitor the success of what they're doing?
Yeah, I think it's really important to recognize that they usually have the proper protective gear, and these times oftentimes we recommend if we're dealing with areas where they may have COVID-19 patients and that they might wear protective gear if they're involved in any type of spraying of anything or coming in contact with surfaces. I think the possibility exists, particularly in a healthcare environment where you may have exposure in the restroom areas or other areas. If you're spraying or wiping, you should have maybe consider face protective gear, I think, at these times, and too, particularly in situations where you may have a lot of people involved who potentially or are infected with it. I think maybe a little more enhancement in protective gear, even to the standpoint of N95. Some of the cleaning and spraying of these facilities to do some deep cleaning in restrooms requires protective gear and training to how to do it properly. We've been involved in assessing how well crews do in that, and really it makes a big difference if they're properly trained on how to clean and disinfect. We've done studies of outbreaks before of norovirus, and actually if they're not cleaned properly, they end up spreading the virus more around with their cleaning tools. So proper use of how to disinfect and clean properly is really important. Otherwise, these people who are in charge of the cleaning on a routine basis can actually be involved in spreading the organisms, we found, at least in some outbreaks we've studied. So proper training can be challenging, but some institutions, particularly some universities in that have facilities where they actually provide in-depth training. University of Washington in Seattle is one which really has a center for training the people involved in everyday cleaning and hygiene maintenance within their facilities. I think that's really needed. I think it's proper training. People who are involved in this need not only the training, but I think the institution needs to be aware of innovations that are going on too in cleaning and in hygiene area in facilities. So I think everybody should really get update information. I know at my own university on a regular basis, I give seminars to the supervisors for the cleaning crews and people involved in facilities management on things to look for and what are new innovations in that. And I think we should do that on a regular basis with all people who are involved in environmental facilities management all the time, because they really play a much more critical role, I think, that's been appreciated. And I think their role will become more recognized because of this coronavirus outbreak.
Have you, you just mentioned that you do a lot of training, and have you seen where, as far as you can tell it's being done right, they're doing a good job at environmental services, anywhere in the country or any hospital that you know of, or is there a grapevine, for instance, about like among environmental
Uh,
staff?
yeah, we of course we've done a lot of studies in different types of institutions and that, and yeah, one of the things that always comes true with us with cleaning and hygiene crews and that is their training. It's really their training that comes down to it, and if they have a procedure and methodologically stick to it, we can find big differences in different institutions. For example, we've done studies where we've come in and we do a background on where the microbiological contamination is, where is it, where does it occur, and that. And then after training of these people, or using professional crews in some cases that have been trained um, by outside cleaning companies in that, we can see a big difference. I think one of the things we notice too, if it's done right and you do a deep cleaning and you do a maintenance of that, it makes a big difference. Even if you're dealing with a facility that's outside of healthcare, we've noticed if you do a deep cleaning on a regular basis every few months, and then you actually come in and do regular maintenance cleaning, you can make a big difference. You can reduce the number of bacteria, for example, in classrooms, in universities. After deep cleaning, it'll keep the number of bacteria down about 90% after you do regular maintenance with that too. So I think there's innovation for that. I mean, we see it in our studies outside the healthcare. It makes a big difference of what people are going to be exposed to.
Do you have to weigh the time it takes to clean a room, an operating room, an emergency department, uh, to standards that you'd like to see or other experts would like to see, against the needing to hurry up and help patients? And uh, is the new technology possibly an answer to that conundrum?
Yeah, I think the continuously acting disinfectants are a new barrier that can be applied. I like the concept because when you get areas that are often missed, it gives you additional assurance. You have some protection. It's not a substitute for regular cleaning and disinfectant, but it adds another barrier to it. And I think we really need that. I don't think it's so much as might be reducing time as enhancing an additional barrier to infection control. And if the areas are overlooked or not done properly, it does add another barrier to that. I wouldn't want to say we need to change any of our routine disinfecting and cleaning all the time, but because these continuously acting disinfectants are available now, they will also give us additional assurance if these areas get inadvertently recontaminated or missed during a cleaning operation, we still have another barrier intact.
Without mentioning brand names, what do you mean by continuous acting disinfectant?
Continuous acting disinfectants are those type of disinfectants where are usually applied to a surface or are a surface, and they continually kill microorganisms that may come in contact, like viruses or bacteria. So in other words, when you clean normally, you disinfect and you reduce the number of organisms by, say, 99%. Continuously acting disinfectants keep killing the organisms below that level, oftentimes if given sufficient time. So you always have something that's always killing organisms all the time if they come in contact. The trouble is you never know when that surface is going to be recontaminated. And so this continuously acting disinfectants give you that additional assurance and barrier.
Is this a fairly new technology?
Continuously acting disinfectants, the concept has been around for about a decade, and its emphasis has largely been in reducing hospital-acquired infections. Now, there's epidemiological data indicates this will reduce these types of products, the number of infections in healthcare environments. But I think more importantly, outside the direct healthcare environment, they're also important, like office buildings, schools, and that. I think they're really needed. In our studies, we've studied tracer viruses or how they move through an office building or a healthcare center. They don't infect people. And we noticed, like in an office building, within 24 hours, 50% of the surfaces will be contaminated with this tracer virus. Same thing in the healthcare environment. You'll see that rapid spread of a virus because of all the activity. And I think these continuously acting disinfectants give you an additional barrier that this will reduce that level of contamination and exposure to people in these environments.
Is it something that you can use with a mop and a bucket, or a rag, or a spray bottle, or how do you use it?
Well, I think cleaning with regular products is still essential for this. One of the concern I had with a lot of cleaning tools, we noticed, you mentioned mops and buckets. Well, they do a great way of spreading microorganisms around if you're not using a disinfectant with that product. You have to remember that anytime you use any cleaning tool, particularly in a healthcare environment, you got to use a disinfectant with it. You got to make sure you have an adequate dose of disinfectants. Otherwise, you'll end up spreading these microorganisms around your facility. And we've seen it with viruses during outbreaks of norovirus.
Has COVID-19 changed the way environmental services will be done from here on out?
I think the future way environmental services will be done, let me restate that. I think because of the SARS-CoV-2, there will be a major change in environmental services, both in healthcare and outside of the healthcare area. Particularly, the emphasis will be on viruses now too. We have to have products that ensure us that they'll be active against the viruses, can reduce the spread of viruses. I know in our institution, university, they're rethinking how they're going to do that to ensure that we have the minimum amount of exposure to viruses to the students when they return in this fall. We need assurances about virus spread. I really feel, particularly when it comes to viruses, they've been really overlooked in general, and we've kind of ignored the importance of surfaces, fomites, in their spread in buildings. We've certainly seen it in our studies. During the cold and flu season, a third of the office environments in the fall, we can find like parainfluenza, which is one of the causes of the common cold, on office surfaces. And they're very common, interestingly enough, in nurse and physician break rooms and that, because they don't get deep cleaning all the time.
Can this be overdone? I mean, how much cleaning can you do?
Well, that's why, how much cleaning can you do? How much disinfecting you can do? In some ways, I feel like currently it may be overdone all the time because it's continually being applied. One of the concerns I'm starting to develop is I see all these spraying of disinfectants everywhere since the SARS-CoV-2 outbreak. And I'm concerned we might be overdoing it. That's where I feel a role of continuously acting disinfectants needs to come in. Between these events when they're cleaning and spraying all the time. And there's a lot of concern too in some institutions, like where we have children, young children or schools, of spraying disinfectants all the time, of making people sensitive to them. So I think there's a balance has to be developed between using our traditional disinfectant methods by environmental services and using continuously acting disinfectants. I think there's a role that we can balance to minimize the risk and exposure via surfaces and fomites of viruses. So I think there'll be more emphasis on virus than there has ever been before. Really, historically, the emphasis has been on hospital-acquired bacterial infections. I think there's going to be a new emphasis in the future on viral infections and how they spread and how we can control them, both in healthcare and outside of healthcare.
Do you see infection preventionists at hospitals working more with environmental services? I think they work pretty closely now, but even closer?
Yeah, I think there'll be more an emphasis on working with them closer, particularly when it comes to virus spread. I think this SARS-CoV-2 has created an awareness of the exposure, really, to the physicians and nursing staffs and other staffs in these facilities. They really are exposed. Viruses spread very readily. It's not just about hospital-acquired infections now. It's about virus spread among the caregivers and the people, the environmental service people, too. And I think that's why we need a real emphasis on controlling virus spread in these environments. I think we saw the impact on healthcare providers, and we need to really give them an additional barrier of protection, I think, that's active against the viruses.
Any final words for environmental services staff who might be listening in?
Yeah, I think environmental service staffs, I think I want to emphasize you guys play more of a role than you realize in studies we've done over the years on how viruses in particular spread in the environment. We've done interventions with trained environmental service staffs, and we were able to reduce the exposure to viruses in facilities by 80 to 90%. And that was just a matter of properly training environmental services people. And that's all it takes. But you play much more of a role. Proper use, we feel in our studies, can reduce transmission of common respiratory diseases by 80% in facilities. So your role is more important. You know, unfortunately, nobody's going to give you a medal for preventing a disease. I always tell my people, you have to realize the importance of what you're doing, because you don't get all the pats on the back you deserve, or the emphasis for the role you played in something that never happened. Unfortunately, we don't honor people enough for things they prevented or that never happened.
Dr. Charles Gerba, thank you for visiting infection control today.